Yeah, that's completely true, Adnan. If you remember, you and I talked about the fact that they put this warning up, they took it down, and now they've put it back up again. I think it's because of a lot of pressure from scientists who have been saying for quite some time that this aerosol or airborne transmission is definitely a way of transmitting the coronavirus. And if you remember, the difference between that and the other transmissions is the fact that these are the tiny particles of virus that can go much further and can linger in the air. The ones when you cough or sneeze, the heavy droplets, they drop to the floor within 2 meters, about 6 feet. But these ones go much, much further. So we had, I think it was back end of August, the British Medical Journal published a letter from 240 scientists. It was an open letter saying people needed to be warned more about the possibility of aerosol transmission. And now on Monday of this week, a similar open letter has been published in the medical journal Science, saying exactly the same thing, saying the fact that this is a possibility, and in various indoor areas the virus can linger, it can hang around, and it can infect people. So it seems the CDC has bowed to pressure, and it's now put this warning on the website, but it still is saying that the main way of people becoming infected is by these heavier droplets and by being near infected people, in close contact with them and for a long time.
Where are we heading in terms of our own personal health and security and trying to keep ourselves from becoming infected? Dr. Fauci, the top guy on infectious diseases in the United States, said about, I think 2 months ago, he said we could be heading for a future where we have to wear goggles. What about aerosol transmission and how masks keep us safe, but then the danger of it entering through our eyes?
Yeah, this is actually something that people have perhaps ignored quite a lot, really. I mean, if you're somebody who's wearing glasses every day, you're going to have a lot more protection, at least coming front ways. Of course, the aerosols can still come in through the sides. The best thing probably is to wear a mask and a visor. That's what they're recommending people who work in hospitality industries should be doing. The visor alone isn't going to do very much. You need, because again, the air can come out and it can come in this way. But the main thing that they're saying with this aerosol transmission is to ensure that wherever we are is properly ventilated. Have a window open. This is something that Professor Paul Hunter, you and I talked about before. He says that you should have a mask, you should wash your hands, you should have the space, but you should also have fresh air coming in and out. And if you're in a building that's got air conditioning or ventilation, to make sure that it's fresh air that's being circulated and not just virus-laden air that's being recirculated. This is something that, you need to check. Say you want to go to the gym, you've got people who are sweating, who are shouting, who are breathing heavily. Make sure that your gym has got proper ventilation with fresh air coming in. This is the type of things that we should all be checking on, really.
Nicola, thank you. Nicola Hill, our health correspondent in London.